You may have noticed I've been turning the bowl in one direction. My grandmother used to tell me the only way to beat cream or egg whites was to consistently beat in one direction. I don't know if it's true, but it stuck with me, and that's the only way I can do it now. You want this to be really thick. Although it's thickened enough to maybe serve on pie, it's not enough for this parfait. So we're going to keep on going. We want it to come out in stiff peaks when we lift the beaters out of the bowl. Now we're going to check it again, and that's looking good. All right, so now it's time to assemble our parfaits. This is something that you'll need to do kind of at the last minute before serving, but you could certainly whip the cream ahead of time, cover it, and refrigerate it. You can definitely make the cookie crumbs ahead of time, and you can even slice the bananas, which we're going to do in a moment. So to make your parfaits, you really have a lot of options when it comes to glassware. So you've got some whipped cream on the inside there. I've brought back from my parents' home in Nova Scotia these parfait glasses, which were a really special item that didn't get used very often when I was a kid. My mom used to do these funky jello parfaits in it that I'm not sure I'd enjoy now, but I loved them as a kid. So those are super pretty, but this dessert also would look great layered up in mason jars, which is very on trend right now. You could use neat little cocktail glasses like this, or even pretty champagne glasses. So it's up to you, regular wine glass, and heck, it would even be good just in a bowl all dumped together because it's that delicious. So to make our parfaits, we're going to start by putting some of the crumbs in the bottom. Again, we're representing the crust with this. So a good generous spoonful in each of our dishes. I'll move these into the middle. And then we're going to add some bananas. It's called banoffee, as I said, because it's banana and toffee. And you want your bananas to be ripe, but not overly ripe. And you can just slice them right into your containers. You'll notice I just pulled off this string. If you've ever wondered about banana strings, because I know I did and I looked it up, it's actually the nutrition vehicle that gets all the nutrition into the banana as it's growing. Who knew? So we're going to slice up a little bit of banana into each dish. I usually put a lot of banana because I really like bananas. This is a great way to get kids to eat fruit because, of course, there's so much other stuff happening in here. Okay, and now we're going to add a little bit of our dulce de leche or caramel sauce. When I say a little bit, I mean a lot, because why not? It's dessert, right? You don't have to have it every day. So you really want to drizzle it on so it coats the bananas and starts to sneak down below. You can put it in a jug to pour it. You might find that a little bit easier. I just wanted to be able to show you the can. There we go. All right, and now our whipped cream. And you don't have to be too precise about how you assemble this. It's pretty free form. If you wanted, it'd be super fun to even set it up like a little buffet station so people could build their own parfaits, and that would be a lot of fun for a dinner party or even for a kid's party. And then we're going to go on with the graham crumbs again. A little bit less on the second layer. And more banana. My mom doesn't like bananas, but I bet you she'd like them if she ate them in this format. And more sauce. You'll notice this is just a little bit darker and richer in color than traditional caramel sauce, and that's part of what makes it so delicious. Trying to avoid getting it all over my hands. And then, of course, we finish with more whipped cream. You can put more sauce on top, but I really like to finish with the whipped cream because it just looks so clean and pretty on top. And depending on your vessels, you can use more layers if you wish, or even just one layer of each. It's really pretty freeform that way. And then if you're fortunate enough to have these great parfait spoons, you can tuck them in. Makes it kind of look like an old-fashioned restaurant treat. And dessert is ready to be enjoyed. I hope these 3 recipes have you excited about the possibilities for a fast, flavorful dinner. This Lebanese-inspired roasted chicken, the frika salad with lots of fresh herbs, and beautiful banoffee pie parfaits are some of my family's new favorites, and I bet if you try them, they'll become your family's favorites too.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Hi Ottawa, we at Rogers TV want to invite you to tune in to Operation Support Local. The idea behind this show is to share stories of those individuals and organizations who have gone above and beyond to help the most vulnerable in our community. We're also going to highlight local businesses who are just starting to get back on their feet, of course, with new protocols put in place to keep us all safe. We're going to share stories each Friday at 7:30 p.m. I encourage you to tune in for new episodes of Operation Support Local.
This is Rogers TV.
Great, thank you. Merci. A few reminders for today's meeting. First of all, happy Pride to everyone. Members of Council and staff, please stay on mute at all times unless called upon to speak. And members of Council, if you wish to speak to an item, please use the raise hand feature located on the bottom of the participants list in Zoom and *9 for members on the phone. This meeting will be broadcast on Rogers TV. Members and staff are asked to position their cameras so that their faces are centered and as close to the top of the frame as possible. And phone-in participants, please do not put the phone on hold. Roll call, please, Madam Deputy Clerk.
Conseil Luloff.
Présent.
Councillor Dudas. Councillor Harder.
Here.
Councillor Suds.
Here.
Councillor El Shantiri.
Present.
Councillor Gower.
Présent.
Councillor Kavanagh.
Here.
Councillor Shirelli. Councillor Eglai.
Here.
Councillor Deans. Councillor Tierney.
Présent.
Conseil Fleury.
Bonjour.
Councillor King.
Here.
Councillor McKenney. Councillor Leeper.
Here.
Councillor Brockington.
Here.
Councillor Menard.
Present.
Conseil Cloutier.
Présent.
Councillor DeRose.
Here.
Councillor Moffat.
Here.
Councillor Meehan.
Here.
Councillor Hubley.
Here.
Mayor Watson.
Ici.
You have a quorum, Mr. Mayor.
Thank you. Confirmation of minutes, adoption de procès verbaux for the regular and in-camera council meetings of July 15th. Carried. Thank you. Declaration of interests, including those originally rising from prior meetings. Déclaration de conflit d'intérêt. None. Communications as presented. Regrets. Councillor Deans advised she'd be absent from the City Council meeting of August 26, and Councillor Shirelli has also sent his regrets. Motions to introduce reports. Motion portant présentation de rapport. Councillor El Shantiri, please, seconded by Councillor Eglai.
Thank you, Mr. Mayor. That the report from the Ottawa Public Health and Emergency and Protective Services Department entitled Temporary Mandatory Mask Bylaw Update, Built Heritage Subcommittee Report 14, Community and Protective Service Committee Report 12, and the report from the City Clerk entitled Status Update Council Inquiries in Motion for the period ending August 21st, 2020, and summary of oral and written public submissions for the items subject to the Planning Act explanation requirement at the City Council meeting of July 15, 2020 be received and considered.
Carried.
Okay.
Thank you. Well, good morning, everyone. Bonjour tout le monde. I want to welcome everyone back from what I hope was at least a week or two of some form of holiday with your loved ones. It's almost hard to believe that it's the end of August and shortly students and parents and educators will be back at school. Now, due to the COVID-19 pandemic, this year is going to be different, obviously, for everyone. There'll be different routines and requirements at schools, and some students may not be physically returning to school, as some families have opted for online learning instead. I know this was a difficult decision for many families to make, and I'm sure everyone is a little anxious about how all of this will go in the coming weeks and months. Nous sommes tous un peu nerveux quand
We're all a little nervous with the return to school, but we'll get through it, and we'll find a new normal.
The good news is that we continue to see a stabilization in cases of COVID-19 in Ottawa, and I remind everyone that our actions right now will have an impact over how the start of the school year will go. COVID-19, of course, is still in our community, and we can't let our guard down. We've seen that it doesn't take much for the virus to spread rapidly, such as
in the U.S. or even in British Columbia, where cases are on the rise again. Ce virus se propage très rapidement et nous
This virus can spread very quickly.
We're ramping up testing. I want to thank my colleagues on City Council for their advocacy to get more testing sites up and running, and very pleased that a new site in the parking lot of the baseball stadium on Coventry Road will open within the next week. This new drive-through testing facility will test residents who have booked their appointment online, therefore reducing both waiting times and the possibility of lineups. Residents will be tested from the comfort of their own vehicle, and the online booking system will be available on Ottawa Public Health's website in the coming days. Despite this increase in testing capacity, those who are exhibiting symptoms should still go to Brewer Arena, where there continues to be a full assessment center. I want to remind everyone that the best way to keep COVID-19 under control is to continue to limit the number of people we get together with for social gatherings. First of all, remember to stay within your bubble of 10 closest contacts, and for larger gatherings where you can maintain a 2-meter distance from others, keep it to a maximum of 50 people indoors and 100 people outdoors. As you know, the City of Ottawa has been under a state of emergency since the 25th of March. La Ville d'Ottawa
The City of Ottawa has been in a state of emergency since March 25, over 5 months.
Not to renew its own emergency declaration, instead introducing new rules that allow the government's executive orders to remain in place without the need for the formal declaration. Municipalities do not have the same legislative flexibility, and communities like ours continue to realize significant benefits by maintaining the declared municipal emergency for the time being. These benefits include a more nimble procurement process through delegation of authority, which is important in the context of a competitive global market for personal protective equipment, for instance, and other important materials. For this reason, the City will maintain its declaration of emergency until at least the end of September. This will preserve a heightened level of vigilance and response capacity as kids return to schools. Other municipalities, like the City of Toronto, are also proceeding in this way, and Council will be kept apprised of any changes in relation to the City's emergency declaration. Nous aviserons le Conseil de tout changement par rapport.
We will advise the Council if there's any change. Aujourd'hui, le personnel présent.
The temporary mandatory mask bylaw to extend it until at least October 31st. The bylaw may be extended further based on the status of the pandemic at that time, and we will review it every 2 months. In addition, staff are recommending that the bylaw be amended to require that people going through the enclosed common areas of condo and multi-unit residential buildings be required to wear a mask. OPH and the City are aware that masking has not been widely adopted in these enclosed public spaces, putting residents from our most vulnerable populations at risk. Following these changes, building operators will have to offer alcohol-based hand sanitizer and post signage at every entrance to the premises advising people of the requirement to wear a mask. Finally, we have seen over the course of the summer a number of large outdoor gatherings taking place where people have not been wearing masks or maintaining a safe distance from one another. In situations like these, where the risk of transmitting the virus is known to be significantly higher, nous devons à tout prix éviter.
We must completely avoid such situation where the virus can spread very easily.
That's why the amended bylaw, if passed by Council today, would delegate the authority to the City's General Manager of Emergency and Protective Services, Anthony DeMonte, to establish mandatory mask zones based on Council-approved criteria and on the advice of Dr. Etches. Mandatory mask zones could be established in high-risk areas of the city, and masks could be required during specific hours on specific days of the week. And any mandatory mask zones created under this bylaw will expire within no more than 60 days, depending on the circumstances. These measures could be especially important now, as thousands of students will be heading back to school across the city. Notification will be provided through updates to the City and OPH websites, social media, posting directly on the designated areas, or direct mail to business improvement areas and property managers. Council will consider these amendments later today, and Councillor Eglai and I urge all our Council colleagues to support this important proposal that will give our staff the tools they need to limit the spread of COVID-19 in our community. We also put in place the measures to help our small business community make it through these difficult times. And I want to take the opportunity to applaud the work of the Economic Partners Task Force and our colleagues Laura Dudas and Eli El-Shantiri, as well as our staff-level Economic Recovery Task Team, who have worked very hard to identify and implement opportunities to assist our restaurants and shops since the pandemic began in March of this year. Your work helped to streamline city processes while encouraging the safe resumption of business activity, restoring business and consumer confidence, and setting the foundation for a return to increased economic activity, which has truly helped businesses survive through the summer. Under the city's property tax hardship deferral program, we deferred to October 30th the tax deadlines for 1,900 property owners who needed a bit of breathing room to deal with cash flow issues. Over 8 weeks earlier this summer, the Buy Local campaign generated more than 34 million impressions and over 560,000 video views. In total, there have been more than 73,000 visits to ottawa.ca/buylocal since late March. And on this buying local note, I'd like to mention that this upcoming weekend from August 28th to 30th is Canada United Weekend. Numerous chambers of commerce, boards of trades, BIAs, and Canadian brands from across the country are coming together on this initiative to promote dining and shopping local. If you shop or dine at an eligible business this weekend, you can enter the Canada United contest for a chance to win a cash prize. I certainly encourage all those residents who are able to participate in these local efforts. As I mentioned many times before, small businesses really are the backbone of our local economy. So please visit gocanadaunited.ca for more information on the contest. Our very successful business reopening toolkit, developed in collaboration with OPH, has received more than 14,000 visits and was downloaded over 1,200 times. Under the Patio Innovation Program, staff estimate that approximately 350 patios and cafes have sprung up across the city, which is roughly 260 more than last year. We also had 7 road closures in place for the purpose of expanding patios, and these are providing approximately 500 paying seats to those benefiting restaurants and very happy customers. I want to congratulate our city staff for their great work that has made a real difference in helping small businesses make it through this very challenging time. Merci à notre personnel municipal.
Thank you to all the city staff.
Food Trucks and Parks Initiative, as well as the Rural Tourism Campaign, which did an excellent job of promoting tourism in our city's rural communities. The campaign featured an interactive photo contest, and it also included Ottawa Tourism's second most viewed Instagram TV video ever. I want to thank all of those who worked on these initiatives for their efforts in support of Ottawa's business community. And also, just as an aside, Councillors Brockington and Fleury and I were at the Rideau Canoe Club announcing the great news that the Canoe Kayak National Championships will take place in Ottawa next year. They're supposed to take place this year. And in about an hour's time, there'll be another great news announcement of another significant event coming to Ottawa next year. But we have to sustain our efforts because fall and winter are just around the corner, and with it will come the end of patio season and sidewalk sales. I've heard it from businesses across the city, and that's what they fear most. As you know, I've offered all members of council, if they'd like me to come and visit some of their small businesses. We had a really great tour in Councillor Tierney's ward the other day, and I did a bike tour in Bay Ward with Councillor Kavanagh the week before. And really a great opportunity to connect and reconnect with these mostly family businesses who are putting their heart and soul and long hours into keeping the doors open during very, very difficult times. Our team is working on a plan to deliver other measures that will help businesses during what could be a difficult period, and I look forward to sharing more details at a future council meeting. Now, we often talk about the negative outcomes of the pandemic, but one of the positive outcomes is the more frequent visits of residents to our city's beautiful parks. This has helped families rediscover their natural surroundings, as well as the health benefits associated with getting exercise and fresh air. Les visites fréquentes au parc à travers la ville sont
Frequent visit in parks are very good for physical and mental health.
us with an opportunity to connect with youth to see how they are navigating through the changed environment and how they can be supported. To capitalize on this opportunity, the city's Human Needs Task Force, through the Integrated Neighborhood Services Team, has developed a Neighborhood Ambassador pilot program. Through a partnership with the Boys and Girls Club, this pilot program is conducting youth outreach starting in the Vanier, Overbrook, and Herongate communities, focusing on addressing the needs of youth in the areas of mental well-being, youth leadership, and employment. In addition to understanding the concerns of youth and listening to what is important to them, the program also aims to discuss COVID-19 related safety. I want to thank the Integrated Neighbourhood Services team for the great work they've done with this pilot project, which will run till the end of September. Bravo à tous ceux qui ont travaillé sur ce programme pour appuyer les jeunes.
Congratulations to all those who worked on this program to support youth in our community.
The team includes Community and Social Services, Recreation, Culture and Facilities Services, Ottawa Public Health, Ottawa Police Services Neighbourhood Resource Team, and the city's Emergency and Protective Services, among other partners. This is a true example of an integrated partnership responding to community needs, and I encourage youth in our community to take advantage of this fantastic initiative. One reminder for everyone, we're still accepting nominations, notwithstanding COVID-19, for the 2020 Order of Ottawa and the Brian Kilray Award for Excellence in Coaching. The Order of Ottawa, as some of you may know, recognizes the professional achievements and outstanding service of exceptional Ottawa residents who have made significant contributions through their professional endeavours to life in the city in any of the following areas: arts and culture, business, philanthropy, health care, education, public service, labour, communications and media, science, sports and entertainment, and other fields that benefit our community. You can nominate an individual online at ottawa.ca, or you can download and print a copy of the nomination form and mail it to us. The deadline to submit a nomination is Friday, September 11th at 11:59 p.m. Je vous invite à tous à soumettre le nom de candidat.
So please submit a nomination before September 11.
Certainly not least, I want to take this opportunity to recognize our city manager, Steve Kanalakis, for his 20 years of municipal service in a management capacity. Steve's dedication and commitment to our community and our residents is exceptional, and I know the last few years haven't been easy. We've gone through multiple floods, tornadoes, and now a global pandemic. We've relied heavily on Steve's strong leadership, and I'm convinced we have and will continue to come out an even stronger community as a result. Thank you, Steve, very much for your dedication, your commitment, and your sense of professionalism in making Ottawa an even better place to live day in and day out for many decades to come. Merci beaucoup, Steve. So now we'll hand it over to the Chair of Ottawa Public Health, our friend Keith Eglai, who again, as you can well imagine, all of you are busy with your responsibilities as councillors and other leadership roles that all of you have. Keith is particularly busy because, of course, public health is front and center in our battle against COVID-19, and he has done a remarkable job along with Dr. Etches and the whole team from top to bottom. I received nothing but very positive comments about public health and their responsiveness and their social media outreach to get information to people as quickly as possible. So, Councillor Eglai, if you could take over, please.
Thank you for the very kind words, Mr. Mayor, this morning. Good morning, colleagues. Again, today, Dr. Etches will be providing an update on our COVID-19 response, and including an overview of the current situation, a look ahead as we prepare for fall. But before she does that, I'd like to touch on a few subjects that are top of mind. Yesterday, Ottawa Public Health shared a document titled Supporting Schools During COVID-19. While we all share concerns about ensuring the return to school is as safe as possible for our children, education workers, support staff, and families, it's important to understand the roles and responsibilities of various partners in this endeavor. As such, I encourage all members of council to read the document carefully and direct questions or concerns to the appropriate agencies. Mask use is another topic on which members of council and OPH have been receiving a number of calls and emails. As you know, on today's agenda, we have a joint report from Dr. Etches and Tony DeMonte recommending the extension and expansion of the temporary mandatory mask bylaw. These recommendations are based on the best advice of our professional staff. And as the Mayor indicated, I would hope, along with the Mayor, that we have full support for this extension and the amendments to the existing bylaw. As we have so often repeated, like hand washing, physical distancing, and staying at home when sick, masks provide an added layer of protection against the spread of COVID-19 in our community. And keeping community case numbers as low as possible will be key as we move into the fall and the reopening of our schools. We all have a role to play in this. Lastly, I'd like to touch on the subjects of mental health and substance use. We know this pandemic is having unintended consequences. Many people are struggling with isolation, job loss, and a host of other stress factors as a result of the pandemic. I want everyone to know that help is available. Please go to ottawapublichealth.ca/mental health for a list of local resources. And please remember, it is okay to be not okay. I'll now turn it over to Dr. Etches.
Thank you very much, Chair. And I have some slides. I'm just going to take a moment and make sure people have the slides available. As usual, I'm going to start with describing what the current situation is of COVID-19 in Ottawa. And I do hope that some of you had some time since the last council meeting to not think about COVID, but to actually take a break. Since you last met, the number of people with COVID-19 did increase in mid-July. There was a fairly steep increase just before and through the opening of Stage 3 venues. I want to highlight on the next few slides that this wasn't necessarily related to the workplaces opening in Stage 3, but more of the sense that things are better and a relaxation potentially of some of the precautions we have been taking. It is the case now that the numbers have stabilized. We have higher rates in younger populations below age 40, but not exclusively. And we see hospitalizations fairly steady. Of course, things change quickly, and since these slides were prepared yesterday, we now have hospitalizations over 10. They're up to 12 again. And our number of outbreaks have also declined, although they continue to occur. We've had outbreaks in child care centers. Right now, there's one outbreak in a child care center. Ottawa Public Health is able to follow up with cases and contacts, people who have COVID, I should say, and those who are in close contact with them within the 24 hours targeted. And our testing volumes have been high and stabilizing. So the wait times now, I'm happy to say, have been addressed. So we're not seeing extremely long wait times. There can be a bit of a wait depending on the time of day. And I know our testing partners are looking at scheduling, which will be a wonderful way to look at reducing wait times as well. When we take a look at the results of all the testing that's done, we see what percentage of those tests are positive. We call that the percent positivity. That we are seeing slightly increase over the last number of days. So that's something we're watching. That suggests perhaps the amount of COVID in our community is on the rise again. But it is still a low level, still about 1% on average. The next slide I have talks about the resurgence risk. When I last spoke to you, I described different scenarios for the fall. I thought the best case scenario, what we're all striving for, our goal, is to keep the levels manageable for our healthcare system, manageable for keeping it out of long-term care and those who are most vulnerable. Certainly trying to have as little disruption of our economy as possible. The pattern I described at a manageable level was potentially smaller peaks and valleys, and this idea of the smaller peak happened to us in July. We'll continue to see how that goes into the fall. Of course, the other scenarios were that we get into more cases, a larger peak where we really have to tackle things differently and target the sources of exposure differently. And we're all working hard to avoid the worst case scenario where our hospitals would be overwhelmed again. Though they have more capacity built, they have better supply chains, etc. So just to say that we have had some experience now of that up and down. On the next slide, I wanted to speak to the different age groups. I think sometimes it's a simple message to say that it's young people or it's people in their 20s who are seeing higher numbers of cases, and contributing to the totals. If you look at the rise has actually been in every age group under age 70. Those over 70 we have not seen since June that kind of rise. And again, this was preceding stage 3, and we saw this rise mostly linked to social activities, private gatherings. I want to thank people for doing their part. It isn't always easy to keep 2 meters distance from others and to wear masks indoors, and these are new behaviors that people are picking up. When we talk to young people, we know they absolutely care about the people in their family, about others who are more vulnerable. And so, I think we need to encourage all of us to continue with the behaviors we know work to control COVID. When I take a look at the numbers of younger people presenting for testing, that's just what we're asking people to do. I appreciate when people have symptoms, we need to make sure it's not COVID, and so I encourage people to continue to make use of our testing services. On the next slide, then, is another way of looking at where are people being exposed. This is one of the top questions I get. So this first slide is the picture from the beginning of the pandemic. What did we see, or what do we see when we look at all of the cases together? It's a bit complicated, so let me try to highlight what's an important takeaway from this slide. The kind of pink rosy color shows that outbreaks do account for most of the cases. That's where most people are getting picking up the COVID virus, especially in older ages, but also through the working age brackets. And then the I don't even know what color to call that, the teal, the greeny blue bars on the bottom, those are close contacts, so household contacts, social gatherings. Those are more likely the source for younger age groups. This is a big picture across time. Now, let's just look at August on the next slide. So on the next slide, we see a different picture across August, and my team would like me to highlight this data is not final because we're still investigating cases in August. We don't have all the information from people yet as investigations continue, but we're not seeing outbreaks play the same role in people being exposed to the virus and picking it up, though there are some, and you can see even the childcare outbreaks show up in the youngest age group here as a source for children under 10. But really, the biggest risk factor for people is the close contacts that we have, and that's all of us. It's hard because this virus isn't visible. It's not always giving people significant symptoms, and people can be infectious before 48 hours before they know they're sick. So by the time one person has symptoms, get tested, others in the household may well have been exposed. We've done polling to ask people about how can they isolate in their homes, what's feasible, and we do find, over 40% of people say it's very difficult to self-isolate in a household. So this is what we're seeing. On to the next slide. I just want to highlight, as others have mentioned, the chair and the mayor, we are very focused on significant pressures ahead, causes for the virus to increase in our community, of course, and cause more demand on the healthcare system when it's at the same time as influenza. So influenza immunization will be a priority. Already we're messaging the importance of vaccination. We're working with our primary care partners to see how much we can spread out access to immunization and make sure that we have the different points of access required. So school opening also, this is our main focus right now with school boards, with parents. It's been a hard time for parents to try to appreciate what's ahead and what's the best for their families. We know that it is quite likely that we will see cases in schools, and we want to keep one child, who may be identified as having COVID. We're trying to limit it to that, so that then we don't see onward transmission in school environments, and that's what everyone's working hard to achieve. We know that more workplaces are opening, and I think what I want to highlight here is for all workplaces, a common message, something very important for all of us to share and propagate is that while we have mask bylaws in public spaces to prevent transmission, we also need workplaces to do their part inside more private settings where there's close contact in the workplace. This also applies, that the masks make a difference for decreasing transmission, and we're encouraging that. So looking ahead, there have been questions, what happens when we all go inside? We know that people have been very adaptable so far, but it has been helpful to be able to be outside and have the windows open. And so we're looking at how to support people with, the best measures possible into the fall. I want to underline that we do appreciate that we won't have economic recovery unless the virus in our community is under control and people have the confidence to resume the activities needed, and that the city's contributions to this effort are extremely important. We're always working together on many fronts. Some are listed here on the slides, but we know that the redeployment of city staff has made a difference, the access to city facilities, the partnership with bylaw, with communications, the human resources. We've hired nurses for schools very quickly. These are all extremely appreciated. So I will spend on the next slide just a little bit time discussing schools, because I know this is of interest. It affects everyone in the community, what happens. Again, we have the same basic measures of being COVID-wise, the distancing, the masks, the isolating, staying home when you're sick, and the hand hygiene. But in a school setting, we have to adapt that. So just so others may have heard in different venues that may be interested, I'll just confirm on the masks. We do not have the recommendation that children in kindergarten to grade 3 are required, that mask use is mandatory. We do want to recommend and highly encourage mask use to become more normalized among children, to build their skills to be able to wear masks correctly. But there is risk when people don't wear masks correctly, especially children and their behaviors. And so we do want to recognize that and find a way to build those skills, but not mandate the mask. It's an area where evidence will grow. We don't have a lot of evidence yet to specifically, guide that decision, but there is a consensus across the medical officers of health in Eastern Ontario, and we are providing consistent guidance on this. Also, we've had questions about the physical distancing in schools because we're recommending 2 meters everywhere. Recommend 2 meters in schools as much as possible. We just understand that it isn't necessarily always feasible, and that the configurations of rooms and classes will vary, and what can be achieved. 1 meter provides protection compared to less than 1 meter. And so we're encouraging schools to go 1 meter and as much as they can towards 2 meters. Those are some of the frequently asked questions. I'm also happy to answer others. For public health, we're advising, we're a resource to schools, and we are working through scenarios and preparation activities to make sure communications are aligned. We will share information if there are outbreaks in schools that will be public. But we also know we need to protect the privacy of individuals, and we don't want blaming or shaming of children and families. Again, this virus easy to pick up without knowing it, and everyone's doing their best. So we know that the nurses will make a difference in schools to answer questions as principals and parents, to advise on infection prevention and control, and to help with the follow-up if needed. So if there is a child or a staff person in the classroom who does test positive for COVID, then we will be most likely asking all of the class contacts to self-isolate until the appropriate time when they can be tested for COVID, or the time frame after exposure to the possible, the source of infection passes. So this specific guidance, again, will be on our website, sharing as much as we can. We just don't have the final documents from the province yet around all of the protocols that they want to see in place across the province. There is a lot of talk about masks, I think, today, and I've picked up a new phrase from Councillor Brockington that whenever we talk about masks related to COVID-19, we want to also be talking about mental health. So masks and mental health is quite, that's my new phrase, that of course, this is stressful for families, it's stressful for children. And so we will be also supporting mental health of children and youth, making sure people have resources and links to additional support if needed when they're back at school. One of the reasons we want children to be back in school. So on the next slide, I know that there's a report from our city colleagues on extending the mask bylaw, the temporary mask bylaw, and I will be happy to answer more questions. What is clear to me is that we still have an ever-present risk of a rise in COVID infection in our community, which will limit significant economic activity, health and well-being, our healthcare system functioning. We just need all the protection we can add, all the layers that will help to prevent transmission, and this is one of them. The evidence continues to grow. People talk about the United States. When you look at which states are doing well, they're the ones that have some form of mask bylaw. There's a lot of evidence that continues to grow, and we'll share that on our website. Every pressure upwards on the growth of the virus needs something to counter it, and mask use, physical distancing, washing our hands, staying home when we're sick are the main levers we have. So I did emphasize earlier, this bylaw doesn't require mask use in all spaces that, we might want to see. And so we do emphasize others, like workplaces, to do their part to educate and carry out the good practice of wearing masks when we're indoors. So I think just to finish, on the next slide, I want to emphasize that we could do this. We will get through this pandemic. I also had the good fortune to hear from some Indigenous partners yesterday and some storytelling about 1918 and the ways people, saw significant impact on their communities, but also took precautions and came through that pandemic. We'll get through this together. It does take each of us. I want to thank people again for doing their part. The uncertainty with schools opening is real. And so today, as always, we ask people to be COVID-wise, continue caring for one another. Thank you.
Okay, thank you very much, Dr. Etches. Chair Eglai will now head to Steve Kanalakis, and then we'll go to questions from members of council for all three of our speakers. Mr. Kanalakis, please.
Thank you, Mr. Mayor, and thank you for your kind words this morning, recognizing 20 years which seem to have just gone so fast in this career. It's been fast-paced, but I've never experienced anything like this, as many of us are saying. This is a once-in-a-lifetime experience. Before I get started, I'd like to wish everyone a happy Capital Pride Week. And while we might not be able to celebrate the same as in years past, We believe that this week still creates opportunities to advocate, educate, and connect. And this year's virtual programming and festivities is a great opportunity to celebrate the contributions by the members of our two-spirit, lesbian, gay, bisexual, pansexual, trans, queer, and questioning community within our teams and in our organization. So thank you all for contributing to our success and for your dedication to serving our city. I'd also like to take a moment to recognize and thank those who have worked so tirelessly over the summer months to respond to the pandemic in our community and to get our services back up and running. Whether you've been on the front line or supporting virtually, your contributions are incredibly valued. And not to mention the work of our colleagues in OPH, who we're so closely aligned with, and OPL and all our community partners across the city. It's really been an incredible one city, one team effort, and speaks to the quality of our community at the City of Ottawa, broader and as an organization. And with COVID-19 still present in the community, this is our first opportunity to City Council in about a month, and I hope all of you managed to get a bit of a break. Many of our staff were on break, and we all needed some downtime to come back to what's going to be a very busy fall. On slide 2, I have a deck here, and it's not up, but I don't know if you can see it, but I'll just walk through it. Today, I'm going to take a few moments to provide you with an update on the city's continued response to the pandemic, and I want to talk about a couple things. The situation right now remains very fluid. It's still present in the community for the foreseeable future. As you saw from Dr. Etch's presentation, there's still so many unknowns ahead with respect to the reopening of schools and how the fall and winter flu season may impact the cases in our community. And as a city, we continue to adapt the recovery and reopening plans based on guidance from OPH to ensure we're doing everything in our control to be prepared for what's ahead. And I want to reiterate that from the beginning, our guiding principle has been the health and safety of our employees and residents. It's been at the forefront of all our planning and all of our service resumption actions. As Mayor Watson mentioned, on slide 3, the city remains in a state of emergency. We know that things could change very rapidly as reopenings continue to take place, and this extension of the state of emergency will give us the flexibility that we need to pivot and respond to potential flare-ups or a second wave of infection as needed. I'm on slide 4. I'm going to spend a few minutes talking about our human needs task force, and I want to commend Donna Gray, our general manager, Clara Friere, who's our new director in Community and Social Services, our entire Community and Social Services team, and over 70 community agencies who come together on a daily basis and manage the interrelationships between very complex services. And they've done an incredible job. And I'm going to give you a little summary of where we're at because we have been away from each other for a while. And I want to give you an update of, and for the public in terms of the effort, the incredible effort that's been made to help our most vulnerable and to help our community. The city continues to address immediate and evolving community needs during the pandemic, and we think that this is going to continue for the foreseeable future. We do not see a let-up. Prevention, containment, and self-isolation supports for at-risk individuals and families living in congregate living situations and experiences